Hi, my name's Alicia, and this year at Community Regional, I volunteered in the CPCU, which is the Cardiovascular Progressive Care Unit.
In the CPCU, the nurses and doctors and PCAs, they all specialize in heart-related issues. These patients are very high maintenance, so there is a lot to do in this department.
On my floor, I became proficient in taking diastolic and systolic blood pressures, introducing myself correctly to patients, donning on and off PPE, and being cautious of precaution signs on the patient's doors before I enter the room. Overall, I held myself to a more professional standard. In my department, I got to observe many different procedures, one of them being a central line. Although I never got to see one get put in personally on a patient, I did have many talks with my PCAs and my nurses about what is a central line when I was helping the patient get cleaned or take a bath.
I will now be demonstrating the correct placement for internal jugular central line insertion. There are a lot of steps beforehand before actually inserting the needle. A smooth central line is all about preparation. To start off, we have positioning. First, you are going to want to make sure there is a lot of room next to the head area. You are even going to want to remove the headrest area. You're going to want to elevate the bed and put it in Trendelenburg, which is head back and feet up, to make the internal jugular vein pop more. After putting on the correct PPE, you are going to need to tilt the patient's head and try to look for the V spot. Now you are going to need to clean the area. Grab an alcohol prep pad, wipe the neck, and remove any jewelry that is in the way. Next is ultrasound. First, you are going to want to put the gel on the probe and then go towards the neck and try to find the vessel lumen. This is what you should see when you're doing the ultrasound. You are going to want to stick the needle in the top right hole.
Now you know how to correctly identify the internal jugular vein. If it wasn't for community classroom, I wouldn't have even had this amazing opportunity. We go through a multitude of series of tests and preparation before actually going into the hospital. For example, vital signs. This is a very well used thing in CPCU, and I would have felt so lost if I had not taken this class. Thank you so much for listening to my community classroom experience, and I hope you know a little bit more about the Cardiovascular Progressive Care Unit at CRMC.